COVID-19 is no longer a public health emergency, but cases are still going around. In fact, we're experiencing a summer surge. So when does the next vaccine come out, and what should you do if you get sick? NBC5's JC Navarrete has the key takeaways.
I was at work on Tuesday feeling perfectly fine, and then woke up Wednesday morning feeling like I got hit by a Mack truck.
Jordan Lucas, like many at home, woke up thinking he had the cold, only to find out it was COVID. His fourth time catching the virus. If it feels like more of your friends and coworkers are dealing with COVID-19, it's because there's a summer surge.
What we're seeing in those numbers and the data that we collect nationally is certainly an underestimate.
Meaning the number of cases is likely much higher than what is being reported.
People don't test the way they used to, right? A lot of people might get sick, just not test at all.
4 years into it, the guidelines aren't as clear as they once were in 2020. So here are the takeaways now. If you're sick, stay home. Test to make sure it's COVID. You can resume normal activities when symptoms improve and you're fever-free for 24 hours. And lastly, bring the mask out before you head out after recovering from the infection.
Here, 4 years later, doctors still recommend testing, even if it feels like what you have may be just a cold. And we all know how uncomfortable this swab is. We all know that feeling. Doctors say that testing will be the way to continue to keep everybody safe.
Metrics that cause concern are all on the rise as well, according to data from the CDC. We're talking cases, hospitalizations, and even deaths. And with school right around the corner, what do doctors recommend?
The absolute key for kids is going to be vaccines.
With the latest vaccine set to roll out in September, we wanted to know how people felt about getting another shot.
Unlikely.
I'm 85, so I'm going to keep right on trucking and get as many vaccines as they offer.
JC Navarrete, NBC5 News.